I'm Dr. Martin Wade, Consultant Dermatologist and the Medical Director of London Real Skin. And today, because it's June, Acne Awareness Month, we're going to talk about how to treat acne scarring. What other techniques can we use for acne scarring? Well, in truth, we often use a combination of techniques. So medical microneedling is a very popular treatment for acne scarring because it's minimal downtime. But then at London Real Skin, we also have a range of lasers that we can use for acne scarring as well. And often we might use these in succession, starting off with more gentle treatments and then going to more aggressive treatments for particular areas if required. We have an erbium YAG laser, which is a fractionated resurfacing laser, so that comes in very handy if we're trying to do a deep and aggressive skin resurfacing technique. But we also have MOXIE, which is a much gentler and lighter procedure, which does a similar job but is just not quite as strong, but is suited for people who may not have such severe acne scarring or people who can't afford to have as much downtime as we might get with the more aggressive lasers. We also have BBL, which stands for broadband light, and this can stimulate the skin to repair itself as well. And so this can be used in combination with the other resurfacing treatment. The advantage of BBL is that there's minimal downtime.